I've been asked to discuss a 27-year-old who's been losing his hair for 5 years. He's worried about the appearance of a strip scar because he wears his hair short. Therefore, he's really interested in FUE, but he has two concerns. First of all, he knows that FUE costs more money than strip surgery does. But he's willing to take the time, raise the money, and have that procedure performed, provided that he can get an equivalent yield that he might get from a strip procedure. Unfortunately, he's been reading, and he's come to the conclusion through his reading that FUE produces a worse yield than strip surgery. Well, this is a relatively common misconception, and really it's disinformation. It's circulated by individuals who, quite honestly, are not involved in FUE on a regular basis, and therefore, perhaps in their hands, they have a poor yield. I can tell you that I've been performing FUE now since 2002. While I've done over 8,000 strip surgery cases, I've now done well over 2,000 FUE cases. And I personally cut well over 2 million grafts. And there was a book recently published in 2008 by Malcolm Gladwell called The Outliers. And the underlying theme in his textbook throughout is what is the difference between someone who's really, really, really good at something and someone who's not so good. And the pervasive theme throughout his textbook is that it takes 10,000 hours of practice to get really good at something. And it doesn't matter if you're a violinist, a software producer, or an FUE physician. It takes 10,000 hours of hands-on time to get really, really good at something. And therefore, I would say that if you choose a physician for your FUE procedure who has limited experience, somebody that performs FUE once a month, once a week, or periodically throughout the year, then the chances are you will not get a really, really good result. So you have to be careful whom you choose to perform your FUE procedure. And choose someone that's either been trained, gotten hands-on training from a physician who has committed his practice to FUE, or choose a physician who actually has committed his practice to FUE. And by that, I think someone that spends 90% of his hair restoration surgery time performing FUE. Not somebody that does it 10% of the time or 50 or 60% of the time, but 90% or more. And then you can probably bet that your yield will be as good or better than it will be with strip surgery. Now, when I converted my practice from strip surgery over to FUE beginning in 2003, when I moved from performing 100% strip to 90% of my practice FUE, I didn't make that change because the results were worse. I didn't make that change because my yields weren't as good. And I didn't make that change because it benefited me. I made the change because it resulted in a superior procedure, better results with fewer grafts, and a better overall aesthetic appearance for my patients in their donor area. We eliminated the strip scar. We got outstanding yields. In fact, I was never concerned about the yields, but I was asked by some strip surgeons to evaluate my yields, and I did do a study. And in that study, I found that 96 to 100% of my grafts grew. It obviously wasn't a very large study because I'm not motivated to do studies to prove to strip surgeons that FUE is a viable solution. I'm really only interested in encouraging physicians who want to become proficient in the art of FUE to how to perform this procedure and to convince them that it is a viable solution. It is a great alternative to strip surgery. Now, there are a number of other misconceptions or disinformation which are pervasive, predominantly through the internet. And these include that FUE results in a higher transection rate than with strip surgery. And this, quite honestly, is inaccurate. In fact, there have only been 2 studies ever performed looking at the transection rate with strip surgery from start to finish. There have been a couple of studies looking at the transection rate when you take hair out of the donor area by way of strip to evaluate what the transection rate is of the strip, but very few physicians, only 2, have looked at the transection rate from start to finish in a strip procedure. And indeed, in one of those studies, it was with micro and mini grafts. And with mini grafts, you'll make less cuts in the strip. And this will result in a lower transection rate, but a propensity toward a pluggy appearance. Well, in both of these studies, the transection rates were 3% to 5%. And I've already shown in FUE that we can average below 3% transection rate performing FUE. So in my opinion, transection is better, potentially better with FUE than it is with strip surgery. Another misconception is that FUE is only indicated for very small procedures. And this clearly is inaccurate as well. Every patient starts with an average of 16,600 follicular units. Some individuals have more. Some have over 20,000 follicular units available. And some people have less, perhaps only 11,500 follicular units available. But everybody has a set number of follicular units available. And we certainly can remove at least 50% of those follicular units and transfer them to the top of the scalp. Because FUE is really the exact opposite of grafting the recipient area. Rather than adding 1 follicular unit at a time to the recipient area, we are taking away 1 follicular unit at a time from the donor area and moving that to the top. So the ultimate goal in someone with advanced hair loss may be to create a density in the donor area that's roughly equal to the density in the recipient area. Another disinformation is that FUE distorts the direction of hair growth. In other words, after a single FUE procedure, you'll have follicles that no longer grow straight out of the scalp, that they've been distorted because of some sort of mysterious scar tissue that develops. Well, this is absolutely incorrect. With FUE, there is absolutely no distortion of the follicles as they exit the scalp. And certainly in my procedures, I've never seen it. But I can assure you that with your very first strip procedure, you will have distortion in the direction of hair growth. And if you continue to do strip procedures, that distortion will get only worse. Another misconception is that with FUE, you have to shave your head. You don't have to shave your head at all with FUE. You can do a completely non-shaven procedure and transfer hair to the top of your head and return to work the next day if necessary. So all of these misconceptions are just simply inaccurate, and they're spread by individuals who really are not dedicated to FUE. They don't have the interest in FUE, and therefore they tend to spread misinformation and disinformation about the procedure as a whole.